Imagine the majestic power and incredible grace of a horse, and then consider its most vital sense sight slowly, insidiously slipping away. It's a truly heartbreaking prospect.
Welcome to the deep dive. Today we're embarking on a really crucial journey into a complex and often insidious eye condition, equine glaucoma. We've meticulously sifted through a stack of essential sources, the latest research, comprehensive vet guides, and our mission today is basically to distill the critical knowledge you need. We'll cover how it's diagnosed, what the treatment options entail, and what the long-term outlook is. We're aiming to cut through the dense material and get straight to the heart of what truly matters for these magnificent animals.
Absolutely. And what really stands out from our sources right from the get-go is something quite surprising. Despite a horse's natural propensity for eye injuries and their, very strong inflammatory responses in the eye, the overall prevalence of glaucoma in horses is actually quite low compared to other species.
Relatively low?
Yeah, relatively low. It really makes you pause and consider their unique ocular resilience. That is astonishing. So if horses are so resilient, does that resilience also make it even harder to detect glaucoma early on? Because their eyes are just so good at masking issues.
That's a great point. Yes, that resilience can definitely be a double-edged sword. It can mask the early signs.
Okay, so before we get into detection, let's lay the groundwork. What exactly is glaucoma in horses? It's clearly more than just high eye pressure, right?
You're absolutely right. It's not just pressure. Glaucoma isn't really a single disease, but it's a group of neurodegenerative ocular conditions. They all stem from alterations in the dynamics of the aqueous humor, that clear fluid filling the front part of the eye. And this leads to an increase in intraocular pressure, the IOP, above a level that the delicate retinal ganglion cells and the optic nerve can actually withstand. So this sustained high pressure over time damages these critical structures, leading to progressive vision loss and eventually blindness.
Okay, so it's not sudden, it's more like a relentless escalating problem. Our deep dive showed this progression often happens in stages, like 5 distinct stages. Can you walk us through those?
Sure. It typically begins with some kind of initial event that impacts the aqueous humor outflow system, basically the eye's drainage system. Then this leads to actual morphological changes in that outflow system, causing an obstruction, and then the IOP starts to climb. From there, stage 3, the elevated IOP severely reduces the sensitivity and function of those retinal ganglion cells. Stage 4 involves the subsequent degeneration of those retinal ganglion cells and their optic nerve axons. So real damage is occurring. And finally, stage 5 is that progressive visual deterioration that unfortunately culminates in blindness.
That's a very clear, but quite stark progression. Is there a typical timeline, or can it vary a lot? And what types of glaucoma are we usually talking about in horses?
The timeline can vary hugely. Depends on the cause, the individual horse. It's part of the challenge, honestly. Regarding types, secondary glaucoma is by far the most common type we see in horses.
Secondary meaning there's another cause behind it.
Exactly. There's an identifiable underlying cause for the increased IOP. Think conditions like intraocular inflammation, especially uveitis, which can be recurrent in many horses, ERU.
Right, equine recurrent uveitis.
Yeah, that's a big one. Or intraocular neoplasia tumors, or even lens luxation where the lens gets displaced. Primary glaucoma, where there's no obvious other eye problem, is actually rarely reported in horses. And congenital glaucoma from developmental issues is very rare, mostly seen in foals.
Got it. So since secondary is the main player, which horses are most vulnerable? Are certain breeds more prone, or is it more about age or having those underlying conditions like ERU?
Well, technically all ages and breeds can be affected. But glaucoma has been specifically reported more often in breeds like the Appaloosa, Pasofino, Thoroughbred, and Warm Blood. What's particularly notable, though, is that increased incidence in horses with chronic uveitis, like ERU. And also, horses over 15 years old seem to show an increased risk.
Okay, now what really caught my eye in our research was this unique thing about the equine eye, how its drainage system is different from ours, or even a dog's. Can you explain that? It sounds like it has surprising implications.
Yes, this is really a crucial anatomical point. It sets horses apart. So aqueous humor is produced by the ciliary body. It flows into the front chamber and then needs to drain out. There are 2 main outflow pathways. You've got the conventional pathway through the iridocorneal angle, kind of the main drain, and then the unconventional pathway, also called the uveoscleral pathway. Now here's the fascinating part. Horses drain a significantly greater percentage of their aqueous humor, like 50% or maybe even more, through this unconventional uveoscleral pathway. Much more than dogs or humans.
50% or more, wow.
Yeah, it's substantial. And this extensive low-resistance pathway might actually be protective sometimes. It could minimize glaucoma development, even when there's some anterior
So it's
uveitis.
like a safety valve almost.
Kind of, yeah. But it's not foolproof. Severe anterior uveitis can still overwhelm the system. It can cause problems like forming prurital fibrovascular membranes, basically, abnormal scar tissue blocking things up, or just physical obstruction by inflammatory cells and debris. That can still lead to increased IOP.
Okay, so it's a bit of a double-edged sword. A robust system, but inflammation can still break it down. And that brings us right back to diagnosis being tricky, because those early signs sound incredibly subtle, easy to miss.
They absolutely can be. Equine glaucoma is notoriously difficult to spot early. The clinical signs are often subtle, and the IOP itself can fluctuate quite a bit. Initially, an owner might just see some mild tearing, maybe the eye looks a bit red, perhaps a slight squint or more blinking than usual. Overt discomfort isn't common right at the start, which, like you said, makes it very easy to miss until significant damage has already happened.
But there was one clue we found, a sort of silent indicator that should raise suspicion even if the eye doesn't look big or obviously painful. What should people look for?
Yes, this is a key nugget, really important for catching it earlier. It's the presence of corneal striae. They're also called corneal endothelial band opacities. And seeing these in a horse whose eye is not yet enlarged, non-ophthalmic, that warrants a high degree of suspicion for elevated IOP.
Striae. What do they look like exactly?
They're linear, often branching sort of whitish lines deep within the cornea. They're caused by stretching or actual rupture of Descemet's membrane, which is a layer in the cornea. They're a subtle sign that the pressure might be building up inside, even without other obvious problems.
Okay, that's a really useful detail. And then as the disease progresses, I assume the signs become much less subtle, more obvious.
Exactly. As it becomes more advanced or chronic, you'll see more definitive and often more painful signs. Buphthalmos, that's the enlarged globe, sometimes called ox eye. That's a classic late-stage sign.
Oxeye. Yeah, that paints a picture.
It does. You might also see severe diffuse corneal edema, making the whole cornea look very hazy or bluish, persistent pain, a fixed and dilated pupil, pupils that don't react well to light. Those are common too. And you might see secondary problems like cataracts, maybe the lens is luxated, and visible signs of damage to the retina and optic nerve, if you can see back there.
So given these signs, especially the later ones, how do vets actually pin down the diagnosis definitively? Is it all about checking the pressure?
Canometry, yeah, measuring the intraocular pressure, that's really the gold standard for diagnosis. The normal IOP range for horses is generally around 17 to 28 millimeters of mercury,
Yeah.
mmHg. So a consistently elevated IOP, say over 30 mmHg, or maybe a difference of more than 5 mmHg between the two eyes if it's just one eye affected, that's highly suggestive of glaucoma.
And you need to check it multiple times.
Yeah, it's vital because the IOP can fluctuate, throughout the day. So serial measurements are often really important to catch those peaks. And a practical tip for vets, always measure the IOP with the horse's head held above his heart. Holding it lower can give you falsely high readings.
Ah, good tip. And this contrasts with simple uveitis, right? Which usually has low pressure.
Exactly. Uncomplicated ERU typically presents with low IOP and a constricted pupil, a myotic pupil. Glaucoma is usually high pressure and a dilated pupil.
Okay. Are there other tools vets use? Especially if the eye is too cloudy to see things clearly.
Yes, definitely. Gonioscopy lets the vet directly visualize the iric-corneal angle, that drainage area we talked about. Ocular ultrasonography is incredibly useful when the cornea is too opaque to see inside. It can help spot things like lens luxation or tumors hiding back there. And sometimes blood tests, serologic tests for infectious diseases might be run if uveitis is suspected as the underlying cause to try and figure out what's driving the inflammation.
Right. So once you have that diagnosis, what's the game plan? Treatment and management sound like it's pretty complex, requires a big commitment.
It absolutely is. The main goals are always 1, reduce the IOP to levels that might preserve vision, and 2, just as importantly, alleviate pain. It often means using a combination of drugs, maybe surgery, and it's typically a lifelong commitment. It's not usually a quick fix.
Okay, let's start with the medical side. What's the first line of defense? What drugs do vets usually reach for first?
Medical therapy mostly focuses on cutting down how much aqueous humor the eye produces. Carbonic anhydrase inhibitors, or CAIs, are a cornerstone. These are often topical eye drops like dorzolamide or brinzolamide, usually applied 2 or 3 times a day. There are systemic CAIs, pills like acetazolamide, but they have more potential body-wide side effects, so they're often reserved for more acute situations.
Okay, CAIs, what else?
Beta blockers are another option. Timolmaliate, Again, usually as an eye drop, maybe twice a day. It also reduces aqueous production. But you do need some caution, especially with smaller horses or those with heart or breathing issues, as it can potentially slow the heart rate or affect breathing.
Now, thinking back to that unique drainage system, that big uveoscleral pathway in horses, what about drugs that work by increasing outflow, like prostaglandin analogs we use in humans and dogs? Do they work especially well?
You'd think so, wouldn't you? It seems logical. But here's that fascinating twist again from the sources. Despite horses having that prominent pathway, these drugs, like latanoprost, are generally not recommended in horses,
Hmm.
especially if the glaucoma is secondary to
Why
uveitis,
not?
because they can cause significant eye irritation and actually worsen the underlying inflammation, make the uveitis flare up, so they can make the whole problem worse, not better.
Wow, that's counterintuitive.
It really is. It just highlights how careful we have to be applying findings from one species to another. What works great in a dog might be harmful to a horse.
Absolutely crucial point. Okay, so what about really acute, severe spikes in pressure, like an emergency situation?
For rapid temporary IOP reduction in those acute crises, intravenous mannitol can be used. It helps pull fluid out of the eye quickly. Beyond that, controlling the inflammation is absolutely paramount, especially when it's secondary glaucoma linked to uveitis. So topical and systemic anti-inflammatories are key. Corticosteroids or NSAIs like phenylbutazone or flunixin miglumin, but, and this is a huge warning, never use topical corticosteroids if there's any chance of a corneal ulcer.
Right, because they stop healing.
Exactly. They can make an ulcer much, much worse, even lead to rupture. Always, always do a fluorescein stain first to rule out an ulcer before putting steroids in the eye.
Okay, vital safety check. So what if the drops and pills aren't enough? If medical therapy just isn't cutting it, what are the surgical options?
Yeah, when medical therapy isn't sufficient, surgery becomes the next consideration. Ciliary body ablation is a common approach. This is often done with a laser in a procedure called cyclophotocoagulation. The laser selectively destroys part of the ciliary body, the part that makes the aqueous fluid. Less fluid production means lower pressure.
And you can do this with the horse standing.
Often, yes. Using specific lasers like ND by AG or diode lasers, it can frequently be done with sedation and local blocks in the standing horse, which avoids the risks of general anesthesia.
That's a big plus. Are there other surgeries?
There are things like gonio implants or drainage devices, shunts basically, but they're less commonly performed in horses compared to dogs or humans. They can have complications.
Okay. And then there's the scenario where maybe vision is already gone, the eye is just chronically painful. What's the final option for the horse's welfare?
In those situations, enucleation eye removal becomes the most humane and definitive solution. It's indicated for eyes that are permanently blind and persistently painful, or if there's an untreatable underlying cause like an aggressive tumor. It provides complete pain relief and significantly improves the horse's quality of life. They adapt remarkably well to having one eye, and they're comfortable again.
That makes sense. It's about quality of life at that point. Which brings us to the prognosis and the long-term picture. What's the realistic outlook for vision with equine glaucoma?
Honestly, the overall prognosis for vision is generally considered poor to guarded, especially long-term. Glaucoma is progressive, it's neurodegenerative. Even if we control the IOP, the damage to the optic nerve can continue. Blindness is often the ultimate outcome. It's worth noting, though, horse eyes sometimes seem to tolerate elevated IOP for longer periods, months, even years compared to what would blind a dog much faster. That resilience again.
So they might seem okay for longer, but the damage is still happening.
Exactly. Which means owners might not realize how severe it is until quite late. The prognosis also depends heavily on the underlying cause. Glaucoma, secondary to ERU, for example, often has a more guarded prognosis because the inflammation is chronic and hard to fully control.
That's tough news for owners, that poor to guarded outlook for vision. How do vets and owners kind of navigate that? Balancing aggressive, maybe costly treatment with just ensuring the horse is comfortable.
That's a really critical conversation. It requires a lot of discussion between the vet and the owner, focusing on realistic goals. Often the focus shifts. Maybe it's less about saving every bit of vision and more about effectively managing pain and maintaining a really good quality of life. This might mean adjusting medications, maybe considering surgery like the laser ablation, or eventually deciding that enucleation is the kindest path to ensure the horse is pain-free and happy, even if blind in that eye.
Right, the horse's overall well-being becomes the priority. And what about ongoing monitoring? What does that involve for an owner?
Oh, ongoing monitoring is absolutely critical. It's not a treat it and forget its condition. Serial tonometry, those pressure checks, are essential to make sure the IOP isn't spiking and that the treatment is working. Initially, that might mean checks daily or weekly during a flare-up, then spacing out to maybe monthly or quarterly for long-term maintenance.
And what signs should owners watch for between vet checks?
A key sign that things might not be well controlled is if the pupil stays dilated. Continued pupillary dilation often suggests ongoing IOP elevation and continuing optic nerve damage. Increased redness, tearing, or squinting are also signs to call the vet. Management strategies also often include things like stall rest initially until the condition stabilizes, avoiding really strenuous exertion, and sometimes using protective hoods like hard or soft cup hoods to stop the horse from rubbing or bumping the painful eye. And a practical point from our sources. Breeding horses with glaucoma is generally not recommended. There can be genetic factors, and it's a lifelong condition to manage.
Right. And the main risks long-term are that chronic pain and eventual blindness.
Yes, those are the main complications we're managing against. Careful, consistent, long-term management is really the key.
Okay, so to kind of wrap this up, we've taken a real deep dive into equine glaucoma today, really illuminated its complex nature. From those incredibly subtle early signs and that really unique eye physiology in horses through to the multi-pronged approach for diagnosis and treatment.
And while we have to be realistic that the long-term vision prognosis is often guarded, understanding this disease, like we've discussed from these sources, allows for proactive management. Strategies focus squarely on controlling pain and extending the horse's quality of life. It really becomes about managing the condition effectively, rather than expecting a complete cure, which usually isn't possible.
And that leads us to a final provocative thought for you, our listeners. If a horse's eye can tolerate these pressure elevations for months, maybe years, in a way that would blind a dog much faster, what does that resilience tell us about different species? And maybe how might that very resilience sometimes mask the serious issues that need urgent attention? Not just in our animals, perhaps, but maybe even in the subtle signs we might be overlooking in our own lives or in those around us. Something to think about.